Dr. Michael Kochman joins me now talking about an issue that really plagues physicians worldwide, and that is infection, specifically antibiotic-resistant superbugs. And you are talking about preventing these scope site infections. So what do people need to know?
Well, there are a number of different steps that have to be taken, but the real issue is to make sure the scope is meticulously cleaned according to the manufacturer's instructions and the FDA approved instructions for the reprocessing.
And there are really national efforts underway to make sure that these guidelines are followed.
Absolutely. The CDC, the FDA, and the manufacturers are involved, as are the GI societies. It's absolutely of paramount importance that we get to zero and we don't transmit any infections to our patients.
And that's one of the things that I think really physicians think about so much. They're thinking about how to treat their patients, but it is so important to have these zero device-associated infections.
When we use our devices, especially the duodenoscopes for patients, we're doing it because there's really an urgent or critical need for these procedures. They're not elective cosmetic procedures, and we don't even want to think that we have to worry about an infection being transmitted to the patient by our devices.
So do you have to choose patients in a certain way to make sure that they would be the right candidates for this?
So the patients that require ERCP, which is a generic term for the procedure that uses the duodenoscope, which is a specific sort of endoscopic device, are patients that really have either an obstruction to the biliary tree, are jaundiced, may have cancers, may have stone disease or bad pancreatitis requiring us to fix the biliary or pancreatic ducts. So that's not elective. There are patients who are obviously in need of something that's minimally invasive.
Are there resources for the physicians or their teams to make sure that you're following these rules correctly?
Yes, there are a number of different resources. There are the FDA guidances on this. There are clearly the manufacturer's instructions for use for the devices. The GI societies have multi-society guidelines on the reprocessing of these devices. And then the CDC and the operating room nurses also have other guidelines and supporting documentation.
Is there any other advice that you can offer to physicians to try to prevent infection, to try to make sure that they've got everyone on that team really all working together to make sure that this doesn't happen?
So I'm part of a CDC task force that is looking at this very issue, and we're trying to put together and assemble the best practices so that we can disseminate those out to hospitals and to the individual physician practices to make sure that they have checklists and guidances on exactly what they should do for surveillance, what they should do and make sure is in place for reprocessing, and how to make sure the people who are actually doing the cleaning are properly trained in that.
And so should they be taking certain training courses, or how do they find that checklist? I mean, you know, I'm sitting here thinking, I want that list.
Yeah.
Because
So the current resources that are available are really the SGNA website has those up. The AORN website has additional resources available. There are resources through the GI societies. The FDA has a number of these guidances and the instructions up on their websites, and of course the companies who will also then help provide on-site training and supervision of that training.
it's such important information, Dr.
Yes.
Kochman. Thank you so much.
Thank you.